Hello everybody. The following PowerPoint presentation will be about the different modalities found in physical therapy that can be used to reduce edema, and they are all based on the theory of compression. This presentation was done by Karina Velasco, Armando Ruiz, and John Eliasquez.
Compression is the application of external mechanical force with an increased external pressure to a body part with edema. Compression increases hydrostatic pressure in the interstitial space and it becomes greater than the pressure inside the veins. Hence, compression facilitates the absorption of fluids by the veins and the lymphatic system. Edema. Edema is a buildup of excessive fluid in the interstitial space. This collection of fluids causes the tissues to expand. It can result from increased filtration of fluid at capillary level or inadequate drainage of fluid at the capillary level. Edema can be reduced by using compression forces.
The circulatory system and lymphatic system constantly pump blood and lymphatic fluid throughout our body by way of movement, work, or muscle activity. This flow and pumping effect can be interrupted by trauma, disease, or surgery. This causes side effects of edema, venous thrombosis, ischemia, and skin ulcers.
Edema can be classified according to the depression and how fast this appears. Mild pitting edema is a 2 mm depression that disappears rapidly. Moderate pitting edema, 4 mm depression that disappears in 10 to 15 seconds. Moderately severe pitting edema, 6 mm depression that may last more than 1 minute. Severe pitting edema, 8 mm depression that can last more than 2 minutes. Edema assessment. Knee girth measurement. First, find the knee joint line, mark it, and then measure 2 to 4 inches above the medial joint line. Mark it with a pen, write down your findings, and then measure 2 to 4 inches below the medial joint line. Mark it with a pen, and also make sure to measure the healthy side too. Figure 8 baseline ankle measurement device. Begin at the anterior ankle just lateral to the tibialis anterior measurement. Then proceed medially, placement of body part into a water-filled tank and bring the tape over fluids collected base of the fifth metatarsal. It can be used for the upper extremity or for lower extremity. Staying distal to the medial malleolus. Circle the ankle around the Achilles and stay distal to the lateral malleolus and where the beginning of the tape starts.
Compression devices are often broken up into two categories, static and intermittent. Both types of compression use mechanical energy to squeeze blood and lymph from underlying veins and lymphoid vessels. Static compression consists of a constant force. Intermittent compression consists of on and off cycles where the pressure changes over time.
Intermittent compression units consist of a nylon appliance designed to fit the body part. For example, the arm as pictured in the image shown here, and is connected to the unit through a series of hoses. The compression is then formed by the flow of air or cold water into the appliance. Intermittent compression units assist in venous and lymphatic drainage by creating a pressure gradient and an on and off cycle. The duty cycle assists in pumping edema out of the extremity. Examples are intermittent pneumatic pumps, controlled cold compressions, or squids. And in class, we have been shown and have used on each other this squid. This slide summarizes key points on intermittent compression. Compression of the extremity forces fluids and solids proximally towards the heart and spreading the liquid over a larger area, allowing more lymphatic ducts to absorb the matter, and thus reducing edema. There are two types of intermittent compression: circumferential, where the entire appliance inflates at the same time, or sequential, where the chambers are inflated distal to proximal. As stated before, the appliance can be inflated using air or chilled water, using cryotherapy properties to reduce edema. Lower pressures are more effective than higher pressures, and the amount of compression should not exceed the patient's diastolic blood pressure. A compression wrap should be applied and the limb elevated after treatment for more efficiency in reducing edema. The first image is a visual representation of sequential compression, where chambers are inflated distal to proximal. The image on the right is a common circumferential compression device that elevates the limb for efficient edema reduction. And at the bottom of the slide, there is a table explaining how the lower extremity uses a higher pressure range than the upper extremity, and the on and off ratio is 3:1 for both extremities. The purpose of intermittent compression is to control peripheral edema due to vascular dysfunction, to prevent the formation of deep vein thrombosis by constantly flushing blood and fluid at the capillary level, to facilitate reshaping of residual limb after amputation. The reduction of excess fluid will also increase range of motion, decrease muscle inhibition, as well as decrease pain.
Contraindications for compression for intermittent or sequential compression pumps: acute trauma or fracture, heart failure or pulmonary edema, recent or acute DVT, obstructive lymphatic or venous return, arterial revascularization, severe peripheral arterial disease, acute local infection, or hypoproteinemia.
A peer-reviewed journal published in 2013 compared intermittent pneumatic compression and NMES to reduce upper extremity edema commonly found in the hemiparetic hand in stroke patients. As we have learned before, NMES and the muscle pump parameters use electricity to stimulate a muscle contraction in a similar on and off cycle to reduce edema. In this case study, edema is commonly found in the affected upper extremity from the inability to voluntarily produce a muscle contraction. The following case study abstract is as follows. Objective. The purpose of the study was to evaluate and compare between the effect of application of neuromuscular electrical stimulation and intermittent pneumatic compression on reducing hand edema in stroke patients. 30 stroke patients of both sexes, 18 females and 12 males. They were assigned randomly into two study groups, each one group of 15 patients. Method. Group 1 received intermittent pneumatic compression therapy, and Group 2 received neuromuscular electrical stimulation 3 times per week for 12 weeks. The patients were assessed for hand volume by using the volumetric measurement and by hand-held dynamometer to measure hand grip strength before and after the end of treatment period. Results. The results of the study revealed that application of intermittent pneumatic compression therapy had a significant effect on reducing hand edema in stroke patients than receiving neuromuscular electrical stimulation. While hand function measured by hand grip strength was improved more significantly with receiving neuromuscular electrical stimulation than the group who received intermittent compression therapy. The following image is out of the case study. The first table is comparison of group 1, the compression therapy group, pre and post edema values. The yellow arrow is showing a significant decrease from 469 centimeters squared to 421 centimeters squared. The second table is comparing group 2, the NMES group, pre and post edema values, and the yellow arrow is showing a slight edema reduction from 464 centimeters squared to 447 centimeters squared. Conclusion. Application of intermittent pneumatic compression therapy was more effective in reducing hand edema than neuromuscular electrical stimulation.
Both static and intermittent compression can help play a therapeutic role by artificially providing resting and working pressure on the affected limb or tissue. A compression garment applies a certain amount of pressure on a tissue when it is at rest, meaning there's no muscle contraction. That's considered the resting pressure. The pressure exerted by the garment on the tissue changes when the muscle contracts, and this is called the working pressure. Compression bandages or wraps come in 3 main types based on their elasticity and the resting and working pressure that they provide. Inelastic short stretch wraps have a low resting pressure and a high working pressure, which means when at rest there's not as much of a compression effect, and that helps so that you can wear those kind of wraps days at a time because you don't get that tourniquet effect. Elastic long stretch bandages have a high resting pressure and low working pressure. They have a stronger compression effect at rest, and therefore you may need to remove those bandages after several hours of use to restore that normal blood flow and lack of pressure. And the third kind of bandages are semi-elastic multi-layer bandages. These combine the best of the other two, and they have medium resting pressure and medium working pressure. Compression stockings and compression sleeves are more permanent and long-term solutions for venous problems, and they're graded. Grade 1, which is considered a mild compression, is 15 to 20 millimeters of mercury. Grade 2, which is considered moderate, is 21 to 30 millimeters of mercury pressure. Grade 3, which is a strong compression, 31 to 40 millimeters mercury. And grade 4, which is very strong, which is anything more than 41 millimeters of mercury pressure.
Research article. In an article published in Biomed Central Journals in April 2019, compared the benefits of compression stockings versus not using compression in post-op after knee arthroplasty to treat swelling. The results show significant difference around measurements of middle thigh, around knee, and mid-lower leg after 10 days. Also, the study showed lower pain in the compression group than the non-compression group.
Pneumatic pump systems. They consist of an electrical air pump that connects to an inflatable garment with plastic tubing. These systems offer the most customizable compression settings, including intermittent, programmable, uniform, and graded resting and working pressures. Some units have multiple inflatable chambers and offer sequential pressure delivery.
And a very common device that you see to deal with edema are cold compression units, commonly prescribed for people after they've had some kind of arthroplasty surgery. You see it all the time with knee replacement. These cold compression units are combining the best of everything, so you get the compression and you get the cold in a simple and easy to use device that just requires ice water. My favorite is the passive gravity unit, which has a little thermostat that you elevate that above where you put your cuff, and the water flows from the thermos into the cuff, and you have ice cold water compressing your swollen or injured spot.